Hello and welcome to #OurDocTalk. This is NorthBay Healthcare's way to reach out to the community to answer questions on important health information. And with us, as always, is Chief Medical Officer Seth Kaufman, and he is also an emergency medicine physician here at NorthBay. And today we're going to be talking about testing and COVID. So let's just get started. What's the latest we're hearing on testing and results in Solano County?
Thanks, Robin. Good morning, everybody. So a reminder who I am. I'm Seth Kaufman. I'm the Chief Medical Officer here at NorthBay. I'm also a practicing emergency medicine physician. So today's topic is testing, a very big topic, constantly changing. I'm going to spend the first handful of minutes talking about some of the data that's out there in regards to the county, and then reviewing the different types of testing. And then I thought I would go through a few different scenarios. So very common scenarios that we see out there, and ask the question, should I get tested? And if so, what kind of test should I do? So first, the numbers. We've had a significant increase in cases in Solano County in the last few weeks. If you do, like me, use the Solano County dashboard on a regular basis as your source of data, it is in transition right now, and the numbers are, there's kind of a catch-up period, and they are updating the data today. So be aware of that. So the numbers I'm giving you might be a little different than what you're seeing. Overall, we're seeing in the last few weeks, really related to the loosening of our shelter in place and a mix of an increase in testing, we're seeing anywhere from a 15 to 30 new cases a day. That's compared to maybe a month ago, a little longer, when we would have less than 10 cases a day. The reassuring sign that things are okay, although it's still very concerning, is that we're not seeing an increase in the number of hospitalizations. So that does reflect that a lot of this is likely related to increased testing, but absolutely part of it is some outbreaks that are out there, and the fact that with the loosening of shelter in place, people are leaving their homes, interacting. So the total case count as of this morning from Solano County is 792 cases. Currently 10 across Solano County are in the hospital, and that is a fairly low number. But the 792 is not a low number. It's not a low number. That is about a 4.3% case rate. So 4.3% of those that have been tested, over 18,000 people, have tested positive, about 4.3%. The numbers at NorthBay reflect that also, pretty similar, both in our urgent care, where we do a good number of our testing, and our ER and our hospital. We're seeing around 4.3, a little higher than that, but that's mostly because we don't test many low people who don't have symptoms. So around 4.3%, or a little north of that.
Okay.
So with that, I want to, in this introduction, talk a little bit about the types of testing we have, and then go through these scenarios, and then I'm happy to, then we're going to go through and start answering some questions. There are three types of tests. There are more than three types of tests, but there are three types of common tests that we utilize. Two are swab tests. So we have a rapid or kind of quick test. And then we have a slow test that takes several days or longer sometimes to come back. And the third kind of testing is the antibody testing. And I want to go through each one and tell you whether it's a good test or a bad test, and then we'll go through these kind of scenarios that I'm often asked about. The first one, let's talk about the slower swab. The slow swab, which is a PCR test, that's one of our most reliable tests out there. You can get that at our county testing sites and our state testing sites. The state testing sites run by OptumServe have appointments online. They're available. There's a Vacaville location and a Vallejo location. These are those very deep nasal swabs. And the turnaround time, once you get swabbed, you'll get a call in the next several days after getting tested. Could be longer sometimes, depending on how many tests they have. That test is very, very good. And like all tests, it's all about the timing. So generally, around 5 days after exposure, sometimes earlier, sometimes later, if you have it, you should test positive for it. If you do test negative, there is a low chance that you actually have it, but your test didn't reflect that. If you test positive for those tests, there's a very, very high chance that it's real. In other words, it's not what we call a false positive, where you actually tested positive, but you don't have the disease. So we trust a positive test coming from a slow swab test where it comes back several days later. When it's negative, we usually trust it. Sometimes if your symptoms look so much like COVID, then we want to retest you because we don't believe a negative test. So I hope that's helpful. The rapid tests are not as good. They're rapid. The test we have 2 tests here at North Bay that are rapid. One is by Abbott, which was a month ago getting a lot of news press. We don't think that's a very sensitive test. The data shows that. So we trust it sometimes. I've said this in talks before. Really, we have to look at the whole clinical picture, but it does come back in about 15 minutes, the rapid test. So the rapid test is helpful when we need to know an answer right now at that moment. A positive test is still more helpful than a negative test. A negative test for Abbott, the rapid Abbott test, if that's the test you get, is very hard to trust. Very hard to trust, and it requires a discussion with the person who did the test or your own doctor of whether it's real or not. There are other rapid tests. Here at North Bay, we just started a rapid test with the BioFire respiratory panel COVID test. It is a wonderful test. It has accuracy very similar to the slow test that takes days, but it comes back in an hour or 2. So that's really helpful. It is a different type of machine. It's really based in hospitals, and it's something we're using in the hospital. And it's not available right now in our clinics, but that might change. But we just started that, and we're excited. We're using it for a lot of our hospital-based patients, including everybody who is admitted to the hospital, and in many situations for procedures and things like that. So it is really exciting, and we feel it's a much better test than the other rapid tests that are out there. Lastly, we have antibody tests. And antibody tests is a much more complicated discussion. We could talk hours about antibody testing. There are a lot out there. If you just Google it, you could order a kit for yourself for $20, maybe less, maybe more, and have it sent to your home. A lot of those tests are not good. My advice on the antibody testing is that you talk to your doctor about getting tested. Quest and LabCorp, our major commercial labs, have some of the best ones out there, and I would recommend if you do get antibody tested to use one of those big commercial labs because of the accuracy of their tests. There are some others out there, but you really have to know how to find the right one to make sure that the result has value. There's 2 types of antibody testing that we utilize most commonly. The one that tests for IgG, which shows that you were exposed at some point in the past, and IgM, which kind of pops up several days, a little longer after you have symptoms, and then eventually drops back down. IgG is very helpful to you and is more commonly tested for, just to show that whether you've had some sort of exposure in the past. If it comes out negative, you might have had an exposure but didn't show an immune response to it. Once in a while, it might be a negative could also just mean that you didn't have it. If you're positive, in other words, you have this IgG, it could mean that you had it in the past, probably at least a few weeks earlier you had it or longer. Or it could, depending on which test you get, that could be reflecting antibodies for a different coronavirus. So you really have to be skeptical of those results. I would say the data is getting better and better, that the good tests are good. But that's why it's so good if you do get that test to sit with your doctor and go through the result and decide what decide what that means. My last comment about antibody testing is that if you do test positive, in other words, you have the IgG, which shows kind of that you've been exposed in the past, it doesn't mean you're immune. No one knows that yet. Don't trust it. It doesn't mean you can't get it. It doesn't mean necessarily you won't get it again and give it to somebody else. It shouldn't change anything you're doing at this stage. It's just information for you. So lastly, I'm going to go through a couple scenarios, common questions I'm asked around when to be tested, and then we'll go into your questions. The first is, a very common question is, I'm going to see my elderly family member or a sick person, and how do I get tested in a way that keeps me as safe as possible when I'm going to see them? I don't want to give them COVID. And the answer, of course, is the first thing to do is make sure you're wearing a mask, doing good hand hygiene, and really have minimal exposure to that person. If you're going to visit them, can you be across the room? Can you be outside? If you're taking care of them and you have to touch them and do things, really good hand hygiene. Don't forget your mask, things like that. In terms of testing, the closer, I would recommend getting swab tested, and I would recommend getting swab tested with one of the slower tests that's more accurate. So that's Quest or LabCorp. Talk to your doctor. Depending on which system you're part of, they may have very good testing internally, not having to go send you to one of these external labs. And you should get tested as close as you can to when you're going to go visit that person. And between the test being collected and the time you're going to see them, you should be extra diligent in quarantining yourself in your home. Don't go to a backyard party or anywhere. Just try to be as careful as you can so you're not getting it in that period of time. Just know none of that is 100%. The swab may not be right. It may be that you were already exposed before the swab, but enough time hasn't gone by before they took the test. But that's my advice in that scenario. Another scenario is, hey, I was exposed. Someone in my house was exposed, or someone was exposed. Should I get tested? I get that question a lot, and the first thing I ask is, was it a real exposure? So, a real exposure is a confirmed positive, not someone saying, I had a cough last week and now I'm in your house without a mask on. It's a confirmed exposure. If it was a confirmed exposure and you had a prolonged period of time within 6 feet of that person without a mask, then, and whether you have symptoms or not, you should get tested. Find out if you possibly have it. I would wait about 5 days from the time of exposure to getting tested, and get tested and see what happens. You may still have gotten it. That test may not be positive, but it'll be helpful information to you. It does take. It's thought to take some prolonged exposure to really get it. So CDC talks about 15 minutes. That's a pretty long amount of time to be that close to somebody. But that's the kind of time we think about in terms of prolonged exposure. But I think it's not arbitrary. But if you were with somebody within 6 feet, not wearing a mask, they have a confirmed exposure, and maybe it's been 10 minutes. Maybe you should think about getting tested. Other exposures, someone coughed near you and you're wearing a mask. That doesn't necessarily mean that you were exposed. Just be really diligent about self-monitoring for symptoms, fevers and cough and things like that. That's my advice. What if, in the same kind of scenario, what if somebody in your household tested positive? Okay, so that's a situation where you're kind of quarantined with them. I would get tested. We absolutely are seeing it go through families. So again, you don't want to get tested too early because the test may be negative, but you actually may have it. So the recommendation right now is really 5 days from exposure. Maybe that'll be very hard for you to measure if it's something in your household that tested positive. But by definition, if they're in your household and you're in the same rooms together and things like that, that's really an exposure concern. And we are definitely seeing families test positive. Lastly, very quickly, I have symptoms. Should I be tested? And the answer is yes. And I would say to you that 6 weeks, 8 weeks ago, when there wasn't enough testing, I might tell my patients, if you think you have it, then act like you have it. Be really careful, isolate yourself. These days, testing capabilities and availability is very good. So if you develop a cough, fever, I would just immediately make an appointment and get tested. That means you are probably exposed, a week earlier. The test timing should be fine. If you're worried, you have symptoms, set yourself up with your appointment with your doctor, which will probably be virtual. You can go to our urgent care. You can go to one of the 2 state testing sites, which are very efficient, online, or call for an appointment and get yourself tested and see if you have it, and be really good about that mask wearing, hand hygiene, and and distancing yourself. If you have, if this whole of all these scenarios involve a nursing home in Solano County, you should know that North Bay is partnering with Kaiser, with our county, and we are testing every nursing home patient and staff member over time. So it is a wonderful program. We've had very few positive tests. It has allowed us to contain any potential outbreak right away. We already have examples where people have tested positive and immediately we've been able to stop any sort of spread. And so you should know that every nursing home patient in the county is getting tested. And of course, there's other programs out there in our prisons and other areas where people are forced to live together, like nursing homes, where testing is happening on a regular basis, and there's active surveillance. So there's a lot of good stuff going on in regards to testing. And with that, Robin, why don't we go to questions?
Well, we have the first question is, are healthy babies 6 months or higher getting COVID?
The overall, no, we're not seeing that. It's something like 1% of cases overall are children, and the data is showing that we're not seeing children. And I have not heard any data. If that whoever wrote that, if you have data I don't have, please let us know. But I've not seen data showing even that extra young population is any different. Very few cases, and they're generally not spreading it to adults. The way they're getting it is from adults. So kids are not passing it amongst each other, and they're not necessarily that we don't see a lot. It's not zero, but we don't see a lot of transmission to adults. There's some exceptions out there, although these are older kids. There's the outbreak in the high school in Israel. There's other smaller outbreaks in schools, but overall, children are really being spared so far in this pandemic. The Kawasaki's-like syndrome that we've all heard about the numbers are very low, thank God. In the U.S., it's a few hundred cases. That's very low compared to the amount of cases we have, period. And those are happening weeks after exposure, and that's really a different discussion than whether kids are getting it at all, but very few cases of children.
Okay. I'm a 67-year-old, and I've been a quote-unquote Girl Scout about being consistent in sheltering in place and only essential errands, but I'm being invited to lunch and parties and book clubs, and sadly I've been declining. Am I missing these gatherings by being too overly cautious?
No, that's a good question. So you're 66 years old, you've been really diligent, and can I go out, can I do things? Is it safe to go to these gatherings? And I'm going to say it's not right now. We are in a transition, and we need to see. I think the way to be safe is to continue to wait and be extra careful right now, and let's see what happens. Do we reach a new plateau of cases, and then we start feeling safer? I would say in someone of older age, and 66 is, I would say, young, depending on who you're talking to. It's all about your physiologic age and not your real age, but that is definitely in the older age groups. I would be extra careful, and I would pass on many of those opportunities. The only caveat is that your mental health is as important as your physical health. So if you need that for your sanity, then accept the safest possible option, which would be outside. It would be people who are as careful as you are, whoever's setting it up, and are trying to space the chairs apart if it's a book club, for instance. It's the time of year when the backyard at 8 at night is wonderful. So can you sit in the backyard with chairs, kind of in a circle but pretty spread out? Everybody brings their own food, or things are wrapped up. Those are the kind of things I think are fairly safe. I know for me, I need some of those interactions right now because it's getting harder and harder, right, to shelter in place. And so if you need that, I think the key is to be extra diligent, the Girl Scout level diligence on making sure that all those things are in place, and then accept one here and there.
You mentioned earlier that North Bay has this BioFire equipment now. Does it just test for COVID, or does it test for a multiple of? So
the question is we have this new testing system at North Bay, in the North Bay Hospital, and does it test for more than COVID? It does test for more than COVID. It tests for other respiratory viruses, although we don't have the ability to test for it now. It requires, it's getting a little technical here, but to test for all those other viruses requires a different kind of liquid in the test tube. And so we don't have that set up yet, but we will in the future. And so yes, it tests for much more than COVID, but right now, to try to get up as quickly as possible, we just got the COVID piece going right away. If we try to get all of it, which requires also some instructions to our doctors and nurses and some other policies and procedures, it would have taken us longer to get the test going. So we're starting with COVID, and then we'll have the rest up in the next few weeks or longer.
Okay. My husband took the antibody test through Quest.
Sounds good.
He swore he had coronavirus in February, but it came back negative. How accurate is the antibody test?
Great question. We think it's fairly accurate. The diagnostic swab test is a little more accurate, but overall, the Quest platforms, the 3 ortho-diagnostic Euroimmune is the second one, and honestly, I can't think of the third one. Oh, Roche, and the Roche platform. The 3 that, as of a few weeks ago, Quest was using are all on the EUA list from the FDA and have shown decent data. So I love to be 100% in everything I do in medicine. It's hard to be. I can't tell you for sure that you didn't have in February still, but that negative test, if they test for IgG, is probably pretty accurate. I've heard this story so many times. COVID infection looks almost like every other virus out there. So highly likely you had a different virus. Highly likely you had a different virus. Sorry.
They should be happy.
They should be happy. Yeah. Some people are like, I wish I was. They like want to be exposed and be done with it. Although we don't know if you're done with it if you're exposed. So I more often than not I get a sigh when people tell me I didn't test positive. I wish I did. So from the antibody test.
So when you look at the county dashboard, does that include North Bay's rapid tests at both hospitals and the urgent care? And will they include tests from the BioFire?
We have standardized procedures, policies, and procedures on how we report to the county our testing. All testing is on that dashboard. It takes days for tests to show up. Over the weekend, it slows down a little bit. So, the date of specimen collection is probably the most accurate piece, the most important piece on that dashboard. It's also constantly being updated. I know that the dashboard is in transition right now. They're going to be changing to some different metrics and statistics, which I think will be great. It's going to be an upgrade, and so be on the lookout for some changes in the next, I think, few days to a week, and I'm really excited about it. But yes, it includes all testing.
Okay. Are people getting tested multiple times? If someone tests negative 3 times, can you tell by looking at the data, or does it look like 3 people tested negative? And like we're trying to figure out the chart.
That's a really good question. Is it is the count, I'm going to repeat the question. I hope you're asking whether the county data reflects just unique people, or multiple testing. That's a really good question. They really discourage multiple tests. And so I don't know that answer. I know that that it's a very low number on those that have had numerous testing. But I will get that answer, but I don't know the answer to that question.
Okay. So if I test positive, but I have no symptoms, should I get tested again?
If you test positive, you have no symptoms, you get tested again. No, you don't need to be tested again. If you test positive and you have no symptoms, the CDC right now, the biggest guidance is the recommended guidance. If you test positive and have no symptoms, is to isolate for 10 days, and that really drops any potential for transmission to a very low level. So no, you don't need to be tested again, and it may just create more anxiety and concern because the test can stay positive for quite a while when you may never get sick from it, and you may never, you may not be you may not be contagious anymore at all because you may have fragments of the virus still in your mouth and nose, but it doesn't mean that can be transmitted to somebody else. So every time, we've had people, they're in the news, there's people in the news who tested positive for months and months, and that can weigh on people's minds, like I'm walking around, because you don't have to stay in, you're not going to stay indoors for months, because you test in isolation for months because you tested positive. So I would get tested once if you're positive, and wait out that period in isolation, and then move on.
Okay. Can they still work, and should they be taking other precautions?
If you test positive, should you be working in the right away? And the answer is no. Employers, there's protocols for healthcare staff. There's protocols for employers. Talk about with your employer, and they'll tell you their policy around this. But no, if you test positive, you should be in isolation. You should not be working.
Okay. Do you think asymptomatic seniors over age 65 should be tested?
Asymptomatic seniors over the age of 65, should they be tested? Yes, I would like them to be tested, but I would like everyone to be tested if we had capability to do that. The answer to that question, if you're a senior, should you be tested? And when you have no symptoms, is yes. I think that would be helpful. The only thing to know is that it's really one point in time. You could have a swab test, and then the next day, a swab test that tests negative, and then the next day you turn positive and you don't know it. Or you get exposed the next day. Or you're exposed 3 days before the test, but it didn't show up yet. So the problem with a swab test is that it's one point in time. So the answer is yes, but really if it has value to you, you're going on doing something with family, or you're worried about transmitting it. The most helpful part, whether you're older or younger, for getting a test when you have no symptoms is if it's helping you feel more safe interacting with others because you have to.
Okay. So do you see it for a day in the future where we're going to have at-home testing, and when that might happen?
I do. There's just some data in the last few weeks showing that a self-administered swab is decent. In other words, a person sticking a swab in their own nose and then submitting it for testing is not bad. Now, the data is really about is not somebody doing it by themselves. It's having them observed by somebody who knows what they're doing. So that doesn't really mean that we're ready for home testing. But absolutely in the future, I foresee a home testing option. The swab test accuracy is almost a good portion of its accuracy is based on the specimen collection process. That if you get a bad specimen from your nose, right, that test result's going to be inaccurate. It's going to be negative when maybe you have it. So we at NorthBay focus heavily on making sure that the specimen collection is as high quality as possible. So if you ever had a test here at NorthBay, you'll notice that we really follow the directions. There's no cutting corners with getting the swab test. So I do think it's in our future, but know that we got to make sure that the test has value. So people would have to be really good about getting a deep swab, or the swab has to be in their nose for the right amount of time, because not doing the procedure for swab collection is the biggest factor in having inaccurate results. But I think it's in the future.
So we have a couple more questions. We're coming
Sure.
up towards the end here, but we're going to get these two questions in.
I'll try to be brief with my answers.
Okay, so we talked about you get a positive test, but you're asymptomatic. What to do, right? So what if you test positive with symptoms? Do you have to test again before going around others?
No, that's not the recommendation right now, although there is some, I think, employers and other groups that are requiring serial testing. The answer is that no, you're supposed to be in isolation until your symptoms resolve, or I believe it's 10 days either way from symptom onset. So no, you don't need serial testing. The goal is to keep yourself safe, don't spread it to others, stay in isolation, talk to your doctor, and wait out those 10 days. For some groups, it's 14 days. CDC right now is 10 days for most. But no, you do not need another test if you test positive and have symptoms. Use your symptom onset date and and you're in isolation for 10 to 14 days.
And one final question here. My in-laws live in Mexico and want to come visit. However, we're concerned about the 14-day quarantine and flying here. If they took a COVID test when they got here, could they skip the quarantine?
The question is if you have international visitors who like to come, and the concern is the 14-day quarantine period. Can they get tested when they arrive and they're good to go? And the answer is sadly no. And there are a lot of hotspots around there. We can't even tell where the new hotspot will be tomorrow and where one area will be better. So the CDC does have some list of countries they're concerned about. We know there are a concerning amount of hotspots in Mexico. Of course, it's very regional. It depends on where your family is. But that test is not going to be positive for 5 days from exposure or longer. So the answer is the quarantine period is really important, and I know it's so challenging, but you gotta do the quarantine period. You can't just test when they arrive. Maybe they got exposed on the plane in. I think international travel remains a risky decision.
Okay. We're out of time, and we just want to invite you all to join us again next Thursday. Our topic's going to be getting out and about and the things that are safe.
Yep, so next Thursday, we're going to talk about, as the shelter in place continues to loosen, how can you stay safe? We'll talk about different kinds of businesses, and when you go to the dine-in restaurant, what should you do? How do you stay safe? The one last thing is based on today's talk, I want you to think about how to keep yourself safe. And whether you need testing. And if you're out there, I hear a lot of different opinions. I don't want to get tested because I don't want to know. I don't want to get tested because then I have to report it to my employer, for instance, or I feel like I need to, or I won't be able to go to work. And my answer to you is, my call to action today for you, what I'm asking for you to do today is if you have symptoms, if you've had a confirmed exposure, go get tested, get the information, and things will be okay. Things will be okay. The majority of people get through the illness just fine, and it's our public health obligation to try to keep everybody safe. And as we loosen these shelter-in-place orders get more and more loosened and we're out and about, the key is that we're testing more and we know who has it, who doesn't, and we're keeping you and everybody safe. Thank you.
Great. Thank you, Dr. Kaufman, and we'll see you next Thursday at 10 a.m.
See everybody next week. Thank you.